So let's go ahead and start. Good morning, good afternoon, and good evening. It is a pleasure to welcome our wonderful panelists and participants from Asia, Europe, and the United States to the inaugural Modern Indian Studies webinar. I'd like to begin by introducing Ambassador Barbara Stevenson, Vice Provost for Global Affairs and Chief Global Officer at the University of North Carolina at Chapel Hill. She will introduce the Modern Indian Studies Initiative and the webinar series. Ambassador Stevenson is a distinguished diplomat, a prior dean of the Leadership and Management School at the Foreign Service Institute, and served as president of the American Foreign Service Association before coming to UNC. In 2008, she was appointed ambassador to Panama and later became the first female deputy chief of mission and chargé d'affaires at the US Embassy in London. Over her 30-year distinguished career, Ambassador Stevenson has served in Iraq, Northern Ireland, South Africa, The Hague, and San Salvador. At UNC, she advances a pan-university strategy to enhance UNC Chapel Hill's international reach, impact, and reputation. We are very fortunate to have her and grateful for her leadership. Welcome, Ambassador Stevenson.
Thank you so much for that gracious introduction, Anusha. I am absolutely delighted to be here with all of you and with such a distinguished panel of experts to help us launch Modern Indian Studies here at UNC. This was a little bit more than a dream when I arrived at UNC a year ago, and watching it become a reality is one of the great highlights of my tenure so far as Vice Provost. We owe Anusha Chari enormously for her leadership of this initiative, and I hope we all just take a moment to be grateful that Anusha has stepped forward in this role. You know, many people that I work with on global issues are, you know, we took at least a pause where our stride was interrupted when the pandemic hit. And Anusha, with her advisory committee, has not been daunted whatsoever in taking the initiative forward. And we will actually use the pandemic as a unifying theme of study to look at the lens through which we're opening up, looking at India. So it's been a remarkable feat of leadership. Anusha, as most of you I know, is an esteemed scholar of open economy, macroeconomics, and international finance. We could not be in better hands than to have her leading this initiative. The University of North Carolina at Chapel Hill has long had strengths in the study of Indian history and languages and culture. We have more students in Hindi classes at UNC than any other university in the country. UNC, though, is building on those historic strengths in our relationship to expand into an interdisciplinary approach towards studying modern India. I want to acknowledge the important role of North Carolina's Indian American community in getting us from where we were to where we are this morning with the launch of Modern Indian Studies. Our robust and vibrant Indian American community believed in this initiative and undertook fundraising. And I remember spending last October at a wonderful Diwali dinner, which was a major fundraiser for this, and listening to stakeholders, many of whom had graduated from the University of North Carolina, talk about the importance of education, overcoming ignorance, just as light overcomes darkness. And it was deeply moving to look at the commitment of our community. So I thank our community again for believing in us and for handing us the resources we needed to get this launched. It's a special day to have this launch. I am delighted to have a panel that is of this quality for this inaugural launch. And I love the part of the welcome which goes good evening, because we were talking before we went live to record. There are many things to mourn about the pandemic, including the loss of people we've loved. One of the things we've gained is an ability to connect more easily across the time zones. We do this naturally now, and I think we have to take full advantage of opportunities like this to keep the free flow of ideas going, to be able to listen to other perspectives, to ensure that our students have a chance to get to know India and India gets to know a chance to know us. So I think we're on a mission here, which is to keep the light burning and to keep the flow of information going, to keep the relationships strong. And Modern Indian Studies is really leading the way in all of this. So thank you, panelists. Thank you, Anusha Chari. Thank you to our supporters in the Indian American community. And I am just delighted to join you this morning in this launch of Modern India Studies and this webinar series.
So Meenu, as moderator, we have a wonderful moderator, Meenu Tiwari, and she's going to take over from now and introduce our distinguished panelists. Thanks, Meenu.
Thank you, Anusha and Ambassador Stevenson, for that introduction. I'm an associate professor here in the Department of City and Regional Planning at UNC. And it is my pleasure to welcome you to the inaugural seminar of our new webinar series on resilience and well-being viewed through the lens of the pandemic. So this series is a set of conversations. It's conceived of as a set of conversations about the impact of the global COVID crisis on the cities, the economy, health, and medicine in India, in comparison with other countries and cities around the world, the challenges that India faces, and possible solutions towards a more robust and equitable future. Our session today on urban recoveries is focused on exploring how India's cities and linked rural and regional economies may recover in inclusive, effective, and creative ways post-pandemic. So after nearly 8 months of grappling with the coronavirus pandemic, the conversation worldwide is now shifting towards recovery. These are still early days, and there is a lot of uncertainty that remains about the possible duration of the pandemic and the spread of disease. And here at UNC, we've seen one result of it in the first week of classes opening, which is what we see all around the world. Yet cities are cautiously opening up. And as they open up, many are wondering, what might an equitable and resilient recovery look like that inoculates them to similar stresses in the future and pulls up those that have suffered so much, including the economy and communities. So as cities ponder over this question, one fact or one point is extremely clear. And that is that the pandemic has revealed in sharp relief the deep and systemic economic and social inequities that plague our cities, regions, and rural economies. In India, the disparities and inequities have been profound, as we've all been reading in the papers, and those that research them know only too well. And they were brought home most vividly by the breathtaking mass exodus of nearly 30 million migrant workers, many of whom walked home from cities back to their villages in the searing heat without food or resources. Equally stark, though less visible, has been the stress on informal workers at the base of urban labor markets. So as cities open up, how can we craft more creative and inclusive strategies to ensure that alongside business recovery and the recovery of the economy, the most vulnerable in our cities are also supported and strengthened in enduring ways? What should the priorities of cities look like? And who acts, who makes decisions at the city scale, especially on behalf of the city's vulnerable population? Especially indeed when local governments are often weak. What lessons can we learn from other cities around the globe that may have done better? So in sum, a resilient recovery cannot be about a return to status quo. It is an opportunity to look for a more just transformation, for innovative possibilities that go beyond urban and rural binaries, to foster vibrant and equitable spaces that are good for human lives, good for the economy, and good for nature. And we have an absolutely wonderful team of panelists today to help us explore and puzzle through some of these questions, for which we may not have the best answers, but we may be able to ask the right questions. So I'll now introduce our panelists, and I'll introduce them in the order in which they will speak. So Shoumik Lal is the global lead for territorial and spatial development at the World Bank, and he's a lead economist for urban development there. He has authored a number of very interesting reports and projects on economic geography for the World Bank, and most recently has been the lead author of the bank's flagship report on urbanization, called Planning, Connecting, and Financing Cities. Welcome, Shoumik.
Thank you, Meena.
And now I'll turn to Mukta. Mukta Naik is a fellow at the Center for Policy Research in New Delhi. An architect and urban planner by training, she currently focuses her work on understanding the links between internal migration and urbanization in the Indian context. Welcome, Mukta.
Thanks, Meenu. Lovely to be here.
Radhika Kapoor is a labor economist and senior fellow at the Indian Council for Research on International Economic Relations, or ICRIER, also in New Delhi. Prior to joining ICRIER, she worked at the Planning Commission and at the International Labour Organization in Geneva. Her research focuses on poverty and inequality, labor economics, and industrial performance. Welcome, Radhika.
Thank you, Meenu. It's a pleasure to be here.
Thank you. And Jagan Shah is an urban planner and senior infrastructure advisor to the India office of the UK's Department for International Development, also based in Delhi. And at DFID, he leads a program that supports the delivery of India's National Infrastructure Pipeline, a flagship project, and is also involved in designing a new multi-year urban program there. And besides that, he has led numerous master plans, regional as well as for the National Capital Region in Delhi. Welcome, Jagan.
Thank you.
So just so that you have an idea of where we are going, the plan for the rest of the time is as follows, that we will begin with brief introductory remarks by each panelist, followed by a moderated discussion. And your questions are very welcome. So please feel free to leave them in the chat box at any time during this session, ideally specifying the panelist that the question is directed towards, and we will be sure to get them to the panelist and have them address as many of your questions as possible. And to finally give you a roadmap, the conceptual arc of the speaker's initial comments from our perspective will loosely be as follows. So Shoumik will start us off at the city scale, talking about the economic and spatial structure of cities and the challenges and opportunities these patterns pose to fostering a resilient recovery, amongst other things. Mukta will then bring us to the realities of these patterns on the ground by focusing on the question of urban migrants and the recent migrant crisis in India. Radhika will then build on that discussion by focusing on low-wage and informal workers at the base of the urban economy. They are a huge part of the Indian labor market. And so we will hear about the many vulnerabilities they face and paths to a more equitable response. And then finally, Jagan will bring us back to the city and regional scale and to the idea of a new regionalism that spans city and even state boundaries. And he'll reflect on the role of technology in fostering accountability and equitable urban growth and recovery. So with that, I turn it over to our panelists and invite Shoumik to start us off. Shoumik.
Thank you, Minu, and thank you, Anusha and Ambassador Stevenson, for this opportunity to join you today on this panel on urban recoveries. I'm particularly excited to be on this panel hosted by Carolina, as I was a student at the City and Regional Planning Department now 25 years ago. And Vanessa, I'd be really grateful if you could run through my slides to help me make my points, right? So let me start by debunking an urban myth that we've been seeing in social media, in the broader media for the past several months. And this urban myth is that dense cities are really hotbeds of contagion, and that urban proximity is a key facilitator in the spread of COVID-19. There could be nothing completely wrong, more wrong in this kind of assumption. This is an urban myth. So Vanessa, if you could go to the next slide. This is a myth because it falsely conflates physical proximity with economic density. And when you think about the risk of contagion increases, in fact, when neighborhoods, they lack the physical structures and the amenities that enhance livability, and where residents have no option but to go out every day in search of employment or services. But if a neighborhood has ample housing, it's got water supply, sanitation, basic drainage, and public space, there is absolutely no reason why proximity should lead to contagion. And let me use this chart in front of you that I did with some colleagues in New York City as an example. And in late March and early April, there was a lot of attention on the downsides of New York City's density. And there were, if you were to switch on television channels in the US and probably other parts of the world, you see images of patients lined up for blocks outside Elmhurst Hospital, overwhelmed with COVID-19 cases. And that's what ingrained in the minds of millions worldwide. And at that time, the borough of Queens was really the hotbed of contagion. So as I was speaking to some colleagues and I was asking ourselves, hey, okay, so what is it about Queens, which is in fact, as you see in this chart, much less densely populated than the borough of Manhattan? And how come Queens has a much greater infection rate compared to Manhattan? And the answer is that in Queens, people live in crowded accommodations with multi-generational families. In Manhattan, you have public health investments, you have lots of great infrastructure, lots of outdoor amenities and space. And what we did in this chart was to track down COVID-19 cases and map them across census tract data on population densities. And clearly you see the better off Upper East Side and Chelsea have far fewer COVID-19 incidence cases, even though absolute economic density is much higher. So this generalization that density is a bad thing is just an urban myth. We should be really, as we think about strategies for recovery, be focusing on economic geography of a neighborhood, of a city, or a region, not just the physical geography, not just the physical density. And next slide, please. So as in New York, there were these stark differences in economic geography. They have been associated with COVID-19 cases, but at the World Bank, much of our interest is to work and support our counterparts in developing country cities. And these are like cities like Cairo, in Mumbai, in Manila, and Nairobi. All these cities have really been struggling to contain the spread of the coronavirus. And a major concern in these cities as well is economic geography, but economic geography of a different kind. And here, a large share of city residents in Asian cities, in African cities, in Indian cities, they live in slums and informal settlements, where they have cramped living conditions, they have inadequate public space, especially water and sanitation at home, and all these features really exacerbate contagion. So to respond to this crisis and help the city leaders at the World Bank, we have developed a methodology that can help city leaders answer one question. And this question is, if we have very limited civic resources, how do we allocate them most effectively to reach the most vulnerable? So the way we went about it was kind of a trial and error process. And when we started working on this methodology, it was late March. and not very many people had a real decent clue of how the coronavirus was going to spread. Everyone was making wild guesses. So we said, what do we really know that can get us something quick that can be used by cities and is reasonably accurate? So we said, okay, we're going to look at three things. One, we need to know where people live, and we need to figure this out very quickly. So we use satellite data from global open source data sets, especially you see this population data from WorldPop. Second, we wanted to know how people live. Do they have enough floor space at home? And here we used a new data set on floor space that we got from the German aerospace industry. And we calculated floor space. And then with data from OpenStreetMap, we got data on the location of water points and public toilets. And on top of this, we asked the question, how easy it is for people to stay at home. And if you were to stay at home, what's the risk of contagion? So you need minimum of this 3.5 square meters of social and physical separation in the house. So using these very simple parameters, we computed a simple algorithm that allowed us to calculate the number of people who would not be able to socially separate. They would not be able to have 2 meters between them. And we came up with these hotspots that under even the most rigid safety measures, here's the number of people at risk for exposure. So let me end by showing you an example from Mumbai. And next slide, please, Vanessa. This is kind of a predicted map that we did on these hotspots approaches for Mumbai. For a moment, just try to imagine if you are in the city of Mumbai and you're in the slum of Dharavi, you have the triple challenge of extremely high population density, very low floor space, and a scarcity of infrastructure, public space, and amenities. Now just try to imagine if there are 68,000 people packed together on 1 square kilometer of land without taps at home, without toilets at home. And using this kind of imagery, we kind of use the algorithm to predict the likelihood of contagion risk in the city. And here what you see in the purple or in the red are the hotspots we predicted. And in the purple are these containment zones, which are current as of May 9th, overlaid with these predicted hotspots. And we find that over 1/3 of the zones are located in our predicted hotspots. We have done such work over 40 cities worldwide. And I really am proud that we've been able to help city leaders ranging from cities like Kinshasa all the way to Manila, help in designing the city responses. And those city responses, Minu, I can speak to later in the discussion. Thank you.
Thank you, Shomik. Yes, we'd love to hear some examples on city responses, and this was fascinating. So we'll move to Mukta now. Okay.
Hi. So Minu's already sort of highlighted the migrant crisis was about an exodus from cities, and those numbers sound really large. 30 million, the government estimates that they carried somewhere between 5 to 6 million people just by train, official railways back. But these numbers shouldn't surprise us. So just to sort of lay that on the table, that the official census data tells us that some 55 million interstate migrants move across the state border in India to work in another location, which means that they lose benefits, social welfare benefits when they move. And there's another estimatedly 100 million, and this is field estimates or not official estimates of seasonal and short-term migrant workers who don't really show up in census or in official data sets or are undercounted in these. And these two categories were particularly highlighted during the pandemic, and that's why I draw attention to them. But other than the numbers, I think there are 3 provocations I'd like to put on the table, more from speaking from my own experience of working with migrant communities and with informal worker communities. So the first is, yes, income losses were vital and people moved because they lost income. But it's also important to consider, as also relating to Shomik's comments, that there was a visceral fear of diseases. And migrant workers were living in these settlements, which were not just dense, but had very congested housing conditions and very poor infrastructure and services. And there was a wave of panic, and the disease will get me in the city. I need to go home. There was a homing instinct. There was a need to either give care or be cared for by people back home. So I think sometimes our economic, analysis can be a little bit narrow and not consider the social and psychological and emotional factors that sort of pushed people. And it also highlighted the multi-locationalism of a lot of people, that families are split across locations in India, and that's very normal for them. I mean, even during an economic shock, quite different from this, like demonetization, migrants moved home because they knew they wouldn't have work in the city for the next few months, and they would come back. And now people are coming back. I'm getting calls from workers whom I'm in touch with here from rural Bengal saying, Didi, sab theek ho gaya. Is everything okay now? Can I come back? We're thinking of coming back. So there is a human sort of a set of networks and interconnections that migrants are working with also. So the second provocation is something that I think Radhika will build on a lot more. But the city was vilified as a hostile place for migrants, but it's not just a hostile place for migrants, it's a hostile place for a lot of informal workers. So the way I look at it, whereas the migrants could leave, of course, not the best thing for them to do. They incurred a lot of costs, not just economic, but other kinds of costs while moving. But informal sector workers, casual workers, people who stood at the labor chalk and sort of worked daily wage jobs, who were not migrants, were actually trapped in the city and were completely reliant on state and non-state actors providing food relief to just subsist and survive. So mobility can also be an advantageous strategy at times to move away from places where you perceive it as a higher, a situation of distress. And we really saw this in the relief efforts as we were providing rations, that the demand for rations shifted away from migrant populations to small business owners, vendors, casual workers as the lockdown progressed and the economy started opening out. And the third provocation is a little bit more about mobility seen as an aberration versus mobility seen as a norm. And this is more my policy hat talking. But when we saw the gradual reopening phase, and the way the disease was administered was through stay-at-home policies and enforcement of borders along districts and states. And so if you were working in an industrial area, but living in a place which happened to be just across a district or a state border, you couldn't access your place of work because you weren't allowed to cross that. So so in a city region, and since we're talking about cities today, I live in the Delhi NCR area in Gurgaon, and if in a city region, this really did not make any sense because clearly we were not even factoring mobility within highly interconnected economic regions like the Delhi NCR, leave alone long distance mobility as we imagine migrant workers, adopting in their lives. So this mobile body question raises questions about the governance of the city. So the mobile body is a problem from the perspective of the citizenship of the mobile body, but also in terms of how mobility itself is facilitated and taken into account in urban governance, overall. So I just leave it at that, Meenu. Yeah.
Thank you, Mukta. Thank you for challenging us. I really enjoyed your comments about the mobile body and the problem that it poses for policy and others. We'll talk more about it. Thank you. And now we move on to Radhika.
Thank you, Meenu. Thank you for inviting me to this conversation, which is really pertinent and timely. So what I'm going to do, as you outlined in your initial comments, is really lay out the nature of the urban labor market to help us understand better why a disproportionate burden of the COVID-19 shock was borne by urban areas. I mean, at least to begin with, there is still considerable uncertainty about how it's going to pan out in the days to come. So if you really look at what the labor force looks like in urban areas, the ILO actually has a very neat classification where they divide sectors into high risk, medium risk, low risk, in terms of the shock they faced. And if you look at the urban labor force, 50% of the urban labor force in India was in the very high risk sectors like manufacturing, wholesale and retail trade, accommodation and food services. And another 30% was in medium to high risk sectors like, transportation, storage and communication, construction. And this was in sharp contrast to rural areas where about 60% is in the agricultural sector, which is relatively low risk. So that sectoral composition of economic activity alone gives us some idea of why urban areas were so impacted by the shock. But then that's not the only factor, and Mukta touched on this. If you look at the nature of work arrangements in urban labor markets, they really are dominated by informal employment. As of 2017-18, just about 21% of the urban workforce was in what we call regular formal jobs. So these are regular wage salary jobs that offer, at least one social security benefit. So a large proportion of the workforce was basically in work arrangements that offered them no security of tenure, no social security benefits, and were essentially in very precarious and vulnerable work arrangements. So these two factors combined together, the sectoral composition coupled with the dominance of informal work arrangements has really made the urban workforce very, very vulnerable to the COVID-19 shock. And again, Mukta talked about the issue of migration, and just to add to that, actually the issue of circular migration and informality are in fact very closely interlinked. People who've been studying these issues of, circular migration, which is really not so well documented in the data because it's underestimated, they basically point out that circular migration, the growth of informal work arrangements have really happened in tandem. And many of the circular migrants, in fact, a large proportion of the circular migrants are in fact in these vulnerable work arrangements. And therefore, when the COVID-19 shock happened and the lockdown was announced at 4 hours notice, they had no option but to resort to walking back to their villages. And this is borne out by a couple of very interesting post-COVID surveys that have happened that have really highlighted how the plight of the urban workforce. For example, there is this survey by the Azim Premji University, which covers 12 states of India, and provides us the stark disparity between rural and urban areas. And they say that about 80% of their sample in urban areas reported a job loss in the immediate aftermath of the lockdown, but the corresponding figure for rural areas was just 56%. 64% of urban households actually said that they didn't have money to buy even 1 week's essentials. And in rural areas, that statistic was much lower at just about 35%. Similarly, close to 90% of the households in urban areas said that they will not be able to pay rent for the next month. So the fact that they're in these informal work arrangements, those that don't pay well, and they are in sectors that don't allow for the remote work option, essentially left them very distressed. And what made matters particularly worse for the urban poor or the urban vulnerable is that when you look at the various relief packages that were announced by the government, the two which have actually been most effective, to my mind, in the Indian context, one is the MNREGA, which is an employment guarantee program in rural areas, and the other is the public distribution system. Both of these have actually not worked for the urban poor. I mean, of course, NREGA is entirely a rural program. It's a public welfare program in rural areas. But even the public distribution system, which is providing rations, it has considerably lower coverage in urban areas compared to rural areas. And we've seen a lot of food insecurity, a lot of hunger, and Mukta talked about that as well. And while a number of state governments did try to do ad hoc measures to give some kind of food relief to the urban poor, but essentially there was no safety net for the urban poor. And this is something which has become very apparent in this crisis. And when we talk about a resilient and equitable and inclusive recovery, I think putting in place urban safety nets is a very, very important part of that conversation. And before I close, I just want to say that, these are the things that we've seen happen during the crisis, but it's worth just reflecting on the nature of urbanization that India has witnessed over the years. And that tells us some pre-existing fault lines. We believe that cities are engines of growth, they are engines of productive job creation. But actually, if you look at all the statistics that I just told you, Indian cities actually seem to be teeming, with informal enterprises, with informal work arrangements. So they haven't actually created the productive jobs that we would expect them to. In fact, if you look at some of the enterprise data, what you find is that the formal enterprises, the medium and the larger size formal enterprises are actually moving out of urban areas, whereas the smaller informal enterprises are urbanizing. So I think, the nature of urbanization we have witnessed. Why is it that we have not witnessed the agglomeration benefits that we would expect to see in this process of urbanization? That also has to be a part of this conversation, because essentially building that inclusive recovery is about both protecting via safety nets and empowering the urban poor and the urban vulnerable. So urban policy, I think, we have to integrate this conversation about productive job creation in this recovery, and in urban policy in particular. Thank you.
Thank you, Radhika. That was a powerful statement, and you brought it all the way back to what we need to do. So we'll talk more about it during the discussion. Thank you very much. And now we come to Jagan.
Thanks, Meenu. I also thank Ambassador Stevenson, Anusha. Congratulations on the setting up of the Modern Indian Studies initiative. I want to, my previous speakers, of course, have laid out such a complex matrix of concerns and based on research. I hope that I will not create any redundancy by sharing some of the experiences that we're having at DFID with regard to post-COVID recovery, as well as our broader reflections on where India is sort of located with regard to its ability to be resilient and respond to these kinds of impacts. So I draw upon a kind of patchwork, if I may call it, of some of our current engagements on post-COVID recovery. One is looking at the most vulnerable, people with disabilities, for instance, who are very difficult to get to, especially in congested localities, and an initiative around that. Helping a state government with policy integration, where they're looking at assured wage employment in cities, very much like the Rural Employment Guarantee Scheme, coming together with making slum dwellers associations actually the interface between the city and a lot of the informal sector, even providing labor and semi-skilled employment. We look at the integration of command and control centers within the smart cities, their use of data in post-COVID response, or rather COVID response, sorry, and the ways in which that kind of spatial understanding that administrators are developing, how that's going to help India actually move forward in good ways about managing cities. We look at the digital divide and how it's impacting girls in the last few years of school and wanting to make a transition into workspaces, and doing some study of that problem, especially with home-based workers and home-based employment. We are looking at a really poignant story that came out of a tribal Schedule 6 area in Eastern India, where the Disaster Management Agency distributed grain, but because the community could not go into the forest to actually collect the biomass that they used to cook, they were not able to cook the grain. So, these kinds of really, sort of impactful evidence that's coming out of this. But broadly, this kind of a patchwork of evidence, including a lot of work that we also do with the World Bank, is that there are two very important prongs that we must work on. One is to understand urbanization, like Radhika also said, patterns of urbanization, and the other is to look at governance broadly and governance reform. In terms of patterns of urbanization, what am I talking about? The World Bank itself, the wonderful study done by Peter Ellis, showed spatial expansion of cities by 80% over a decade. We did a study at the National Institute of Urban Affairs earlier, where I was working, which showed that speculative development had added more floor space across all 640 districts that were studied than the growth of population, sometimes a factor of 3.5 in terms of the rate of that growth. So speculative, a lot of real estate development. The World Bank talked about a messy and hidden urbanization, 8,000 urban centers, which are not all recognized as statutory towns. Therefore, half of them actually don't have municipal administrations. Urbanization in India has also been unequal. There's within cities, there's ghettoization, there's elite capture of commons and streets and such like spaces. It's also becoming quite clear that it's environmentally unsustainable. The externalities of the pathway of development are extreme, and while we are making progress on things like renewable energy and such like, that needs to get accelerated at a very large scale. And lastly, a characteristic of the urbanization seems to be what I would now describe as glutted urbanization. There is a glut in terms of built space, even commercial space, residential space in categories that are no longer useful, and we are wanting to actually house millions of people who are deprived of housing. So there is that problem of the wrong kind of development. In public delivery systems, there are some very key axioms. I think professionalizing of urban management is key. The use of integrated spatial decision support systems is now a very welcome technology and system within the Indian government, which is good. We are working on delivering demand-based learning through a national urban learning portal. That's really important because urban managers need access to bite-sized knowledge as well. Looking at revamping the planning framework, there is a guideline that was created in 2013 that encourages the governments to look at regional and urban development together. But that guideline has not seen light of day, so to speak, in terms of implementation. That's largely because land records modernization hasn't taken place. Urban data capture and information retrieval is very difficult. Integration of land use with various other kinds of infrastructure doesn't take place. And lastly, we've got to fix the problem of very low participation. And there are some wonderful entry points there, and that's where I'll shift to my last couple of points, which is really about the green recovery after COVID. What are those openings and pathways which are promising? Clearly, participation is one, and the enablement of participation through the creation of database systems, data systems such as community-level observatories, city-level observatories, these will clearly develop the infrastructure for a new age, so to speak, of participation. There is the need to manage density, not to abandon density, but to manage it well. I heard Shomik very well when he was saying about sort of what Ava Joshi-Ghani and Ed Glazer have been arguing, that you need that density, and I don't see that completely evaporating as a need as we make this transition. The work that the Indian government is doing now, really developing the institutional architecture for local governments, that's very heartening. So there is something there to look forward to. Very importantly, after 73 years, we finally got a policy on rental housing, which translates into at least the creation of affordable rental housing for especially the working class in cities. How this is going to play out, we don't know, but it's just recently been announced. That's a heartening sign, but nevertheless, we need to watch this space. And last but not the least, we have to develop the ecosystem services, the ability of architects, planners, technologists, social scientists to work together to retrofit the existing habitat, because we have to deliver an equal standard of habitat to all. I'll stop there. Thanks.
Great, thank you, Jagan. So you've brought us into the policy space, and we'll come back and talk more about it. And now I'd like to pivot to our discussion. So I'll open up the discussion by first asking each of you a question, and then you can respond to it, and others may, if they wish, can also add to it. And I'll weave in audience questions as we go along. So I'll start with Shomik. And so Shomik, there is this very sort of provocative distinction you've made between physical density and economic density. And we had a question from Professor Bish Sanyal, who said that you mentioned the term economic geography. And so what is the difference between economic geography and economic density? And does that mean that residential density by itself does not explain the spread of infection at the current time? And how do we use this? How do we understand and operationalize these distinctions that you have? So that's one. And I'll just add one more. And that is to say that we'd love to hear the examples that you mentioned of what other cities and states are doing. That what lessons do you and others draw from their experience? I know you've talked about Cairo and you talked about other places in your work. So I'll let you respond to these two questions and then pick up more from the audience later on in the second round.
Thanks, Minu, and thanks, Professor Sanyal. And I really appreciate the comments the other panelists made, particularly, I think, the issue of migrant workers and the issue of informality in the labor market. I mean, if you think about India's urbanization more broadly, I think, you know, the research really needs to point out why is it that India's cities cannot get economies of scale and specialization, which is really what is needed to stimulate productivity. And yet, I think I'm going to definitely send an email to Radhika later, because you mentioned this vignette that if the medium-sized enterprises are leaving the city, then is there a whole spread of infrastructure everywhere that allows them to be productive? But let me get back to the main question of density. So typically when you look at, you know, density, how do people measure it? Either you're a planner or an academic, you probably measure it by people living on a square meter of land, or people living on a square kilometer of land. Now think about 10,000 people living on 1 square kilometer of land, absolutely flat, without services, without amenities. That's Dharavi. Now you could have 10,000 people living on a square kilometer of land with a lot of structures, a lot of investment in capital, a lot of floor space. And in fact, that distinction is the investment that's put on the same piece of land translates into differences in living standards. But the way this investments in the piece of land happen, because there's some inherent value of land that made developers come up and build up high and build up structures, right? So there is an economic rent that kind of went into, you know, these capital investments. So that's the basic foundation that we distinguish as physical density, people living on a square kilometer of land, versus economic investments and people on that same amount of land. And I think what you will see, Minu, is that the data to do this is very limited, because most measures of density are two-dimensional measures of density. And that's why I was very excited when the German Aerospace Agency has now come up with the first three-dimensional view of the world. So you can in fact see for about 800 cities in the world for one time period, how high are the buildings. And this is, like, I think for research and for policy, this is really important, because you can translate the heights into floor space into capital stock, and you start understanding what is the capital value of investments in a city. It's never been done before, right? So that's why we start making these distinctions in some quick and dirty analyses that we are planning to do. Now, just before I come to the examples, I think on Jagan's question also, I think there were kind of important issues that you mentioned about density and kind of the investments. And I think one point you really mentioned, which I think is absolutely important in India, is improving the capability of urban management, because what we're going to see post-COVID is amenity shopping of high-skilled labor across the 7 metropolitan areas. The places that manage the cities better are likely to do well, It's not that suddenly 7 metro areas are going to translate to 200 little towns getting economic activity. You're going to get high skills basically being mobile across the 7 areas. Now, in terms of the examples, the way I think about how we think about the medium term is to do some very basic stuff, especially in countries such as India, but elsewhere, where I think the amount of capital investment in the longer term needed to finance cities is large, but the policy measures still need to be strengthened. So what I do in a piece I co-authored with Same Waba is that we outline some very basic steps that cities can take in the short to medium term. The first is to plan, provide, and protect public space. And the reason I see public space, I lived in Mumbai for many years, and one thing you see in Mumbai is if you're walking out at 1 a.m., right? 1 a.m., and you go down Chowpatty, you get all these people who are basically trying to benefit from the amenity of looking at the sea because they live in very cramped quarters. And in fact, this public space makes urban cramped living sort of bearable. And even in the pandemic, you see how Mumbai responded, which I thought was very interesting, is the Goregaon Park where beds were installed in this nature park, and the nature park sits right next to Dharavi, right? And here, that's a kind of good example how we really need to repurpose and protect public space. In a city like Barcelona, you'll see that there are all these new ways in which open spaces have been used for kind of social separation during the pandemic. If you look at a city like Bogota, they've added about 100 kilometers of bike lanes to the already extensive network, you know, just letting public space, increase public space. The reason I put emphasis on that rather than private space is that think about what your income levels need to be as a country to be able to afford a major increase in housing. You need to be about $3,500 or $4,000 country where, and I think this I drew from Professor Sanyal's old work, is that in fact, if you're really a poor country with limited capabilities, you spend most of your money on food and you spend most of it on basic things, right? When you get to middle incomes, can you start spending on durable infrastructure? And I think so in the interim for a lot of our cities, we just need to think about public space first. Second is I think something Jagan will probably speak to much more articulately, is about changing regulations to provide more floor space even for the affordability we have, right? I mean, think about the building standards and the FSI and the FAR regulations in Indian cities that are broad swathed and are keeping the amount of floor space down. As a result, you're seeing housing prices go up, land prices go up, and a lot of speculation happening. I think the 2 examples I really like recently that what the city of São Paulo has done is to, you know, really downsize the FAR, reduce the kind of ceilings to the floor area ratios with higher zoning maximums in different areas to see where can the market really accommodate it. And then nearer to where I live in Fairfax County, they have been really giving out these TOD restrictions recently around the transit system to encourage more densification. But Minu, if you look around the world, there are many cities that are really trying to relax zoning and density caps so that more floor space can be provided. I'm going to stop at my 3rd point, which I think is really important, is how do we think about building urban infrastructure finance capabilities to get communities to have a bigger handle in improving their living conditions. And I think this is a point both Mukta and Radhika mentioned. Listen, if you're living in a slum and you don't know who is the person in the political economy who is giving allocation of grants to your neighborhood, how do you think about it? So in Indonesia, they have a slum upgrading program called the Kotaku, where they've been getting COVID-19 protocols in construction works. And the way they're doing is that they have got the community involved very carefully into the design of amenities that the neighborhood requires. But the way they're doing it is not only the financing through the communities, but systematically building community capability to take on construction works themselves. So even during the post-pandemic times, you have cash for work programs. So I think getting the communities more capable, building capacity, and getting them to have more of a voice in designing how the community should look like is really, I think, important. Okay, I'm going to stop here and turn it over to the others. Thank you.
Thank you, Shomik. That was interesting. I will actually be the devil's advocate and maybe raise a question that has also come from the audience. And you don't have to answer it right now. We'll circle back to it at the end, and maybe the other panelists, whom we'll turn to now, can also address it. And that is the question about an exception. So, you spoke about Dharavi and the densities, but we read about the Dharavi miracle. And as Chandrachari also mentioned in the comments that, can you throw some light on this containment miracle which happened in Dharavi, where everybody was so apprehensive that it would be a disaster in the making, and it didn't happen. And so as, we talk about densities, is there something else, like community organizations, what you do, the role of other kinds of, arrangements that really transcends or overcomes the problem of density? So I'll let you mull over it and then turn to Mukta. Mukta, you can address this question about Dharavi as well. And then the question that I had for you was that you've spoken really evocatively about migrants being lost within the spatial and institutional loops of multi-locational livelihoods, which you call the problem of the mobile body and the opportunities of the mobile body. And I was curious about who is it in our cities, city spaces, or even regional spaces or rural spaces, but particularly cities, because we're talking about cities, who are the key actors that are making decisions about them, about these kinds of communities? Who is it that worries about their food security and safety nets that Radhika also talked about? And these are sort of hybrid, hyphenated urban residents, not exactly residents. So who makes these decisions? Who are the actors that are doing the work? Yeah.
That sort of links to, Samik also mentioned the political economy of the Indian city, and migrants specifically. What is the citizenship of a migrant is dependent on whether the migrant is coming in from a very nearby area and votes in the same state, or is not a voter there. So there's a political, directly electoral component to that as well. But lots of migrant communities actually get embedded locally and become local voters, but may be considered outsiders in a cultural sense or in a linguistic sense. So there are, political and also class overtones to this, to the issue of migration, and who really thinks about migrants. I mean, this is a question that I've actually gone and asked city, planners. Also, when I think about who do you ask in a city about the city? That itself is an interesting question, because it's not necessarily the planner. I mean, in many cities that I study, it's the real estate developer body that actually thinks a lot more about the city, because they are very, very invested in how the city is growing. Or it could be local chambers of commerce or industry, or local, and connections between politicians and investors. So these are the kind of internet worked groups that drive the city. Often rural elites, like in smaller cities in India, rural elites who have now invested in the city may have a very big, may worry a lot about the city. But do they worry about the migrant? Perhaps not. They may worry about them as their employees. So they may worry about, like an industrialist in Kishangarh, which is a marble processing sector that I did a lot of work in, would worry about migrant workers from Bihar from the perspective of providing them housing. because that's necessary for them to be able to come to work and be productive and run the shift of the factory on a literally 24-hour kind of a basis. But they're not worried about the kind of things that you're talking about necessarily. So that's I think the gap. And what COVID revealed really was that the source states of migrants were the ones who were worrying about them when they were at destination. So Bihar was calling Haryana and calling Maharashtra and saying, you know, can you locate where our workers are? Can you make lists? Can you enumerate them? Can you get them on trains and send them home? And these destination states did not really have a very clear idea of they couldn't answer these questions very well. And I think that's really where we are now trying to close that enumeration gap in some way, partly motivated by the question of labor and economic revival. And there is, of course, the question of social welfare, but I'm not sure it's as much, it's a pressing political question, but I'm not sure whether anybody is really motivated to do that. So that's an open question. We can talk about Dharavi later, but just a small point on that is I think the lockdown and the inability of people to move, and therefore the inability of sort of national pan-India aid agencies to sort of just have, you know, these relief efforts going everywhere really, I think, brought out localized collectives and what people could do locally and how they could band together to do things. The case of Dharavi and disease management is very specific, but everywhere we saw that the formations that came together to distribute food or the very unlikely kind of linkages that were formed, for instance, elite housing condominiums doing things for slums in the locality, which they didn't really otherwise interact with in a very systematic way. So these are things also that were interesting to I think, note and to maybe take forward in some way.
Fascinating. That's very, very interesting. And I'm sure there'll be lots of case studies done by students for their theses on it that we'll learn from. Looking forward to that. And I also remember you said that it's the district that really also did the administrative work rather than local governments at this time. So we can come back to that, but thank you very much. Very interesting points. And I just want to make a note of our time. We are at 11:02. This session goes till 11:15. We have a little spillover possibility, but I just want to give you a heads up about where we are. So I wanted to now turn to Radhika. And Radhika, you have you know, very persuasively argued about the importance of understanding the nature of urban labor markets in order to understand the problems with India's pattern of urbanization, and then to figure out what is it that we want to do. So I just wanted to ask you, and you mentioned the importance of the safety net on the one hand, and then, you know, growth on the other in order to shore up the most vulnerable in cities. So bringing Narega and these others to urban areas, and the ration card idea, having a pan-India ration card that has just been introduced, is also, it fits into some of what you said. But what I was interested in was that, you know, at a time when a lot of people now have been talking about a basic minimum income program. I know it hasn't been popular for a long time, but, you know, very respected people, guys standing, I mean, many people have been bringing it up as something that we need to begin to consider. And so what is the role of employment generation in particular in these urban labor markets from your perspective as a way to bring broad-based growth, as opposed to a program like the universal basic income that could be used to mitigate some of these perverse effects? So I'll mention that. And then I also want to say that there is a question from Kedar Kalambe, who asks, directed to you and also to Mukta, what steps should state and central governments take to revive the real estate sector, which provides employment to a large portion of these low-income, low-wage and migrant workers? So I'll turn to you.
Thank you, Meenu. So I think you raised a very pertinent question. The idea of universal basic income is something that also gathered steam in India last year before the general elections. And, you know, it's one which is obviously picking up a lot of traction in the developed world in the context of automation and machines taking over jobs. But I think for India, I mean, and this is to my mind, I don't think that we are really ready for this idea at this point, and that's for multiple reasons. I mean, just to begin with, we don't have the fiscal space to do anything of this sort. And now, especially with growth contracting, with revenues collapsing, there is no fiscal space to do it. If somehow we did manage to even do an income transfer for a small proportion of the population, I think the identification of that group is extremely challenging, given that 50% of the workforce is actually self-employed, and we know very little about what their incomes actually are. But the question really is that what is the purpose of this minimum income guarantee or an income transfer? At the end of it, despite the fairly impressive growth rates that India has witnessed in the recent past, we still are a low middle income country. And the most recent poverty data that we had is of 2011-12. And even by the median poverty line of the World Bank, 60% of India's population is below that. Now, a lot of that problem is essentially linked to the lack of there being well-paying jobs in India. And so therefore, if you have to address that problem, I feel the focus needs to be on creating better paying, more productive jobs. And here I think an employment guarantee program can actually play a very important role. Of course, you definitely need one in urban areas because, like I said, we don't have a safety net. But if you intelligently design an employment guarantee program, that can actually help you achieve minimum income. For example, simply by ensuring that the wages which are paid in an employment guarantee program, ensure a basic, decent standard of living. At present, even NREGA does not actually pay minimum wages. So NREGA wages are outside the ambit of the Minimum Wages Act. So if you design the employment guarantee program in a way that you pay those decent wages, you can actually leverage it to create better paying jobs, because that also sets a wage floor. It enhances the bargaining power of labor in a labor surplus country. And importantly, I mean, there is so much scope for productive asset generation in India, and you can exploit these programs to do that. I mean, there was a question about the role of construction. And it is true that in the period between 1999-2000 and 2009-10, the share of construction in total employment in India doubled. And that is a sector which can generate employment for a lot of low-skilled and unskilled. And an employment guarantee program, again, that is focused on infrastructure generation can help in that. I mean, there is a lot of talk about how NREGA actually is just a ditch-digging exercise. There was that perception of NREGA to begin with in the earlier days. But, now there are enough studies which tell you that a lot of rural roads, water management projects have actually been built through NREGA programs. So therefore, I think it makes more sense to move towards an employment guarantee as opposed to an income guarantee. And there was also a question about data on the urban informal economy. I don't know if you want me to touch on it now or come back.
Please go ahead. Please go ahead.
Okay. So I think, that was a really interesting question. I think to begin with, we have to recognize that the informal economy by definition is very hard to capture. And informality happens at multiple levels. There is an enterprise-based definition of informality, and there is an employment-based definition of informality, which stems from, whether you have access to social security benefits in the Indian context, at least. And actually, contrary to the perception there is about data in India, I think that some of the questions in the household labor force surveys do a reasonably good job of telling us about what the broad contours of the urban informal economy are. Now, of course, we'd like to know a bit more about who the home-based workers are, who are the gig workers, which are gaining a lot of traction again in the urban economy. These are challenging things to capture, and we have to appreciate that. The one area, though, where there is a serious lacuna in terms of data for the urban informal economy is that we don't get data below the state level. So there was also a question about, can we say at the district level, what has been the impact of labor markets? So, if you ask me that what is the sectoral composition of employment at the district level, we don't actually have data to answer that. So maybe in terms of level of granularity, going down to a more disaggregated level, we could do better. But otherwise, I think one does get a reasonable idea of what is happening to the metrics in the urban informal economy.
Thank you very much. That was it feels like a start to a conversation rather than ending here. So thank you for that. And now I'll turn to Jagan. So Jagan, you have a couple of questions from the audience, which I will first talk about, and then I can bring in my own question. So one question from Greg Randolph was directed to all panelists, but I think you can speak to it as well, that can we say something about the difference between how small cities versus metropolitan centers have fared in terms of, economic and labor market, as well as health impacts of COVID? This was one question. And then there's a question from Anjali Mahendra that's directed to both Jagan and Shomik about the role of funders like the World Bank and DFID. Like, how do we ensure that finance provided to national state governments for basic infrastructure and services is targeted to the most vulnerable communities and locations in cities? What specific mechanisms are used in your institutions to ensure that communities are given more power and voice as part of their infrastructure finance decisions? And some examples would be great. And here in the US, we have something like the community benefits agreement process, where when you have a developer doing private development, the government can come in and sort of require them to participate in local hiring or to train workers or to do a certain other set of things in order to get benefits that stay in the locality even after the developer leaves. So with these two questions, let's get back to you, Jagan.
Thanks, Meenu. Great questions. Let me address the first one about the small cities versus the metropolitan. From what we know, basically the most extreme overcrowding and the most extreme densities of population are in metropolitan regions, and the northeast district of Delhi, for instance, is the most densest part of India. Smaller cities tend to have the potential for retrofitting their densities much more. So in terms of COVID response, it's the smaller cities that are able to also think in terms of where they might need to now locate a medical facility, or where they need to locate sanitation facilities or housing. That flexibility is a little more limited in metropolitan areas where land markets operate in very different ways. In terms of the participation process, I think Anjali, one very good example is what I mentioned earlier about slum dwellers associations. This is in the state of Odisha, where the state government has taken a very, very enlightened policy with regard to empowering slum dwellers associations to be both the interface between the civic government and the community, but also the managers of community level processes, whether it is participation in planning decisions or the use of dedicated funds in municipal budgets, which are dedicated as per government policy for improvement of living habitat and living conditions for the poor and such like. So there are some very good initiatives by state governments in the country which can be replicated and can be scaled up. And in fact, this from Odisha state government now, the central government has in fact encouraged other states to adopt a similar model. I think in terms of the participation process, I just wanted to say that there is before we close, I wanted to mention one thing that gets left out in a lot of the conversations about both urbanization as well as economic processes and how they're impacted. I think it's left the development community, the multilateral development banks, or the donors like the UK government, which influence, I think, a lot of the political economy in the country today. Remittances, studied very well by the World Bank, the remittance economy is a very little understood and less studied part of this whole impact on the urbanization. A lot of the speculative development may well be, and we don't have enough evidence yet to understand it well, but may well be because of remittances. being invested in property development, which may actually have no occupation, but nevertheless command urban space and influence the local political economy of cities. So there are these very fascinating sort of points here. Ultimately, I think as Mukta had mentioned, who decides? I think Gerald Frug at Harvard put it very well in 2016 in The Urban Age. He said, "Who decides? Who decides?" That is sort of like a crucial question for cities and urbanization. And I think these can only be solved if that participation is more than token. Currently, Government of India policies, state government policies require participation as per process. But how participation is managed is quite another thing. So, this, in some senses, this may actually demand new skills and new service providers to actually begin to mediate participation processes and new evidence to be easily accessible for informing participation. I'll stop there.
Well, thank you very much, everyone. That was a great discussion, and I'm happy to say that we covered most of the questions in the chat box as well. And so I will, as I bring this to a close, I want to thank all of you. I just want to say that, I would have loved to ask Shomik a little bit about the public space that he talked about, one of his most important points. So when there's so much pressure on land, how do you protect public space? When people say what you need to do is build housing. We don't have time to discuss that, but it's food for thought. And for Jagan, I would love to have heard a little bit more about your community observatories, which was a very interesting way to bring in technology to the ground in order to facilitate or foster participation, just the note that you ended on. And then I wanted to refer to Radhika's point about the importance of what you call automatic stabilizers, by creating income at the bottom through employment that is sustainable and that translates through the economy, rather than having another administrative process to put in place, like the minimum income program might later on, and helping us see the distinction and the relationship between informal workers, migrant workers, circular migrants, and all of those things. So, that was very, very interesting, the relationship between labor and the nature of urbanization. And finally, Mukta, thank you for pointing out the importance of the local political economy and the intricacies of how these institutional arrangements that vary across communities, including the point that you mentioned in the chat box about Dharavi, that when you're not being straitjacketed into certain kinds of, processes of action, you might be, it might create the opening for more innovative and locally rooted bottom-up initiatives. So both, Radhika and you have talked, both of you have talked about the importance of some bottom-up approaches as well to shore up the most vulnerable. So I want to thank all our panelists for this very stimulating discussion. I want to thank our audience for all their questions and for participating. And then in closing, I want to invite Anusha to help us close the session, and to thank Vanessa and everybody else that has worked behind the scenes. Anusha.
Thank you so much, Meenu, for giving us such a thoughtfully curated conversation. It was really amazing to hear the powerful insights of our distinguished panelists and for your thoughtful comments. And I have to agree with you. It really feels like the beginning of the conversation, not the end. We have only scratched the surface, but we're so grateful to our panelists for having joined us. I'd also like to thank our attendees. Thank you very much for registering, and I hope that you found this discussion illuminating and thought-provoking. There have been a number of people who have worked very hard behind the scenes, and I would like to take this opportunity to thank them First of all, our star is Vanessa Aganobi, who has done a fantastic job of the logistics and sort of sorting out all the technical details. Vanessa is a senior in the Hussman School of Journalism and Communications at UNC. I'd also like to thank Katie Bowler-Young and Katie Costanza at UNC Global, as well as the Carolina Asia Center for hosting the Modern Indian Studies Initiative. Thank you very much for joining us today for this inaugural Modern Indian Studies webinar and for making it such a success. Thank you again, and good evening, and have a good day and a good evening. Thank you so much. Bye-bye.